All right, so we're going to go through a couple like brief kind of case questions for Alzheimer's disease. So we got Mabel over here. Mabel is an 81-year-old referred to the memory clinic with a history of memory loss. She's accompanied by her daughter, who reports loss of function over the last 6 to 12 months. Now, Mabel's minimizing that impact. That does happen a lot. And she does, however, agree that she is experiencing some senility, right? So there's this conflation that does happen where individuals will just say, well, I'm just getting old, right? But it's truly becoming a cognitive impairment challenge. So what are some important questions to ask to assess Mabel appropriately? So certainly we want to think about reversible causes. So asking about their medical history. So do you have diabetes? Do you have hyperlipidemia? Do you have a history of stroke? What medications are you taking? Doing some lab tests to assess for things like vitamin or nutrient deficiencies, things that we can particularly address and maybe improve the baseline for Mabel, right? So certainly some things to take into consideration. Second question, what monitoring would be appropriate for someone who starts aducanumab for mild cognitive impairment from Alzheimer's disease? So this is a select all apply. We love those, right? MRI, EKG, ApoE4, or pulmonary function tests. So the answer here, if we want to think about it, right, we're going to need baseline and periodic MRI monitoring for presence of ARIA. EKG is not required here. ApoE we will do to assess for risk of ARIA, and if they're negative, we can move forward. And then pulmonary function tests, the monoclonal antibodies in this scenario are not significantly associated with change in pulmonary function. Question 3, right? So for a patient treated with donepezil for moderate Alzheimer's disease, a decline of blank points on the MFC at 12 months would be considered treatment success. So is it 2, 3, 4, or 5? Now, if you remember, if we go back, I can kind of show you what that goal is. Oh, I hope I didn't go too far. I did not. Right? So 2 or more, essentially, right? So if they decline, less than or equal to 2, I speak backwards sometimes. Less than or equal to 2, decline is good. 3 or more is bad, okay? So when you're reading this question, I just like to point that out because sometimes when it's like or equal to, it can be a little bit tricky. So a decline of blank is considered a treatment success. So a decline of 2 or less, right? Because if we were thinking 3 or more, this would be a little bit different. So sometimes it's about reading the question. All right. Well, thank you guys so much for listening in. I hope you learned something today. Take care, and thank you once again.